Hey everybody, thanks for joining me today. This is a moment with the Oily Doc. I'm just going to give you a few minutes to go and grab your favorite oil because we want to oil up and we can learn some great information today. It's going to be kind of high intensity. So today I'm starting with rosemary. It's going to help me fight against the electronics that I'm around today. So I'm going to slather on some good rosemary. All right. Okay, so let's get this started. Okay, so for those of you that don't know me, I am Tiffany Roberts, and I am known as the Oily Doc. I like to start out each session just kind of describing who I am because we have newcomers every week. This kind of gives you a little background about who I am. I have a master's in nutrition. I am a certified functional medicine practitioner, and I'm currently working on my PhD in clinical nutrition. My husband and I have a holistic medicine clinic here in Prairie Village, Kansas, just outside of Kansas City. And this is where we help hundreds of people every year with chronic issues along with acute issues. And we incorporate lifestyle and nutrition along with healthy relationships as part of those treatments. We strive to educate everyone on natural approaches and just kind of give you information on natural means that you may not have already known about. So as you can see, that natural healing is kind of a passion of mine. I do have a beautiful 3-year-old daughter, and she actually really loves the oils. So every time we get an oil shipped in, she's curious about what we got that week. I also have 3 wonderful stepchildren, 2 fur babies, and some chameleons and lizards thrown in the mix there. And we're a very busy and happy family. Thank you for taking time out of your very busy day to listen to me. I do appreciate you doing so. Do me a favor and like this video and share it with your friends and family because my goal is to educate everyone on different health issues that might come up. So let's talk about a couple disclaimers before we begin. A Moment with the Oily Doc is not supported by the FDA and not used for the intention of diagnosis or treatment. The information that I am providing is strictly for information and educational purposes only and can be controversial. So you should consult your physician before starting any kind of regimen. Also, though, that I am not telling you to get off your medications. This needs to be monitored and reduced by your physician. If you would like a natural, holistic doctor to work with your physician, you're welcome to contact us at functionalmedicinekc.com, and we'd be glad to work with them. Each session will cover different topics in hopes of educating you on certain health issues. My goals for these sessions, again, is just education because I feel that the more educated you are, the more power over your own health that you have. And that's very important in today's society. And my goal is basically to get down to the truth and to let you know that you were meant for a life of purpose, wellness, and abundance. Today, we will be discussing heart disease. And this topic kind of hits home for me because many of my family members have suffered or even died from heart disease. And hopefully the rest of my family members will be watching this presentation because it does affect us all, and I literally take it to heart. We will be talking about the risks involved and what causes heart disease, what to look for on a comprehensive blood panel, and what your options are in preventing heart disease. So if you have heart disease or heart issues, if you know someone that has heart issues, if you have family history of heart issues, then I encourage you to listen to this presentation. First of all, what is heart disease? Most people think that it is affected of, heart attack or stroke, but there's many things that contribute to heart disease. There's many names associated with heart disease, such as myocardial infarction, arteriosclerosis, which is the plaquing of the arteries, tachycardia, stroke, etc. So, however, there are causes that lead up to these issues, and it's not what you think. Most people are under the impression that cholesterol causes heart disease. Let me tell you this, there has never been any research to prove that. You need cholesterol for every cell of your body. Your brain is made up of half cholesterol and half fat. So if you take a cholesterol lowering medication, you're reducing this in your brain as well. That blood is going everywhere in your body, not just your liver. Okay, it doesn't just stay in your liver. Every single cell is flowing through that entire body. So you're reducing that cholesterol in your brain as well. And by reducing that, you could lead to Alzheimer's. You need cholesterol for hormones, both men and women. You need cholesterol for every cell wall in your body. All your cells need cholesterol. Every type 2 diabetes that comes into our office is on a statin medication. The FDA is actually fighting right now to put a warning on cholesterol lowering medications saying that it will cause dementia and diabetes. So the next time that you look at a commercial or an ad for these cholesterol lowering medications, I want you to take a look at that fine print, because at the bottom of every single ad or commercial, it clearly states, and I quote, has not been proven to prevent heart attack or stroke. Okay, guys, it says it right in front of your face. That doesn't make sense. That, why would you take a medication that damages the liver long term? And why would you take the medication that clearly states it's not preventing the issue that you are taking it for? Cholesterol is not the cause of heart attack or stroke, heart disease or stroke. There are over 900 studies shown that cholesterol-lowering medications are dangerous. Most muscles, and let's think, the heart is like the biggest, most important muscle in the body. It pumps all our blood. It is a muscle. So any muscle problems are the most common or best known side effects of these medications, along with cognitive problems, pain or numbness in the extremities, blood glucose elevations, anemia, cataracts, frequent fevers, sexual dysfunction, immune suppression, liver dysfunction, pancreatic dysfunction, and more. So there's your dementia and your diabetes right there. These facts that I just talked about was found in the American Journal of Cardiovascular in 2008. Another study in the Archives of Internal Medicine says that at Framingham, they found that people who ate the most saturated fat, the most cholesterol, and the most calories weighed the least, were the most physically active, and had the lowest serum cholesterol. And that was by Dr. William Castell, and he's a medical doctor. So the number one cause of heart disease is inflammation. And you can look that up on PubMed. There's lots of articles that talk about inflammation. And inflammation causes heart disease, among other issues. Increased stress, poor diet. So sugar is a huge inflammatory marker. It causes a lot of inflammatory issues in the body. So sugar is number one. Carbohydrates, those things like that. Lack of exercise, all cause inflammation. If you are not eating a healthy paleo or ketogenic diet, if you're just kind of a couch potato, if you have constant high stress levels, then your body will react to this and create inflammation to try to rid itself of that problem. With inflammation being present long term, this creates plaquing. The arteries try to protect itself by creating that plaquing. So another reason it could be hereditary. If you have family members that have heart issues, or you have even died at an early age, you do have a good chance that this could be hereditary. For my family members that are watching this, I'm talking to you, okay? You need to come see me to get this under control. If you have a hereditary if it is hereditary, that doesn't mean that you can't prevent it. There are always things that you can do to help prevent or even reverse issues. So please keep that in mind. So let's talk about some items on a comprehensive blood panel that your medical professional may not run, or if they do, they might look over it because there's no pill for it. And these are your silent killers, okay? C-reactive protein, your CRP. CRP is one of the proteins that increase during systemic inflammation. This is caused by stealth infections, inflammatory fats, the bad fats, inflammatory sugars that I just talked about above, among other things. So inflammation is the process by which the body responds to injury or infection, like we just discussed. These numbers for CRP run from 0 to 3, and ideally you want it to be 0. The closer to 3 you are, you have a relative risk for future cardiovascular event. We've had patients come in that have been to multiple physicians and they just can't find anything wrong with them, but there is a problem. I simply look at the C-reactive protein on their blood test and the numbers are outrageous. One person was over 90. I quite honestly don't know how she was, sitting in front of me. Another item to look for is your homocysteine levels. This is major, guys, so please, if you don't listen to anything else, listen to this, okay? Homocysteine levels increase in the body when the metabolism of methionine to cysteine is impaired. Okay, this may be due to a dietary deficiency of vitamin B6, B12, or folic acid, and this is associated with plaquing of the arteries and blood clots. You can't get homocysteine from your diet. It has to be made from methionine, which is another amino acid that is found in meat, fish, and dairy products. Vitamin B6, B12, and folic acid are needed to make this reaction occur, okay? Foods containing methionine are transformed into homocysteine in the bloodstream. Homocysteine is converted in the body to cysteine with vitamin B6 facilitating the reaction. Homocysteine can also be recycled into methionine using B12 related enzymes. So cysteine is an important amino acid in the body that has many roles, okay? It's involved in the way proteins within the cells are folded, maintain their shapes, and link to each other. Cysteine is a source of sulfide and is part of the metabolism of different metals in the body, including iron, zinc, and copper. So cysteine is also an antioxidant, okay? If homocysteine cannot be converted into cysteine or returned back into the methionine form, levels of homocysteine in the body increase. And elevated homocysteine levels have been associated with heart attack, stroke, blood clot formation, and perhaps the development of Alzheimer's disease. This clotting factor is very sneaky because it will cause clotting without raising your blood pressure. So nobody knows this, guys. Your homocysteine, if it's above the level 10, you have a major risk for heart disease. We like to keep our patients' homocysteine levels at 7 or below. And if you would like your levels checked, I encourage you to contact our office at functionalmedicinekc.com. So another one is lipoprotein A. So LPA consists of LDL cholesterol bound to protein apolipoprotein. Okay, that's a big old mouthful. But it is 10 times worse than LDL. Okay, an elevated LPA is a strong risk for heart disease and an increased risk in it's completely independent of age, sex, whether you smoke, and any kind of serum levels for cholesterol, triglycerides, or HDL. It is strictly genetic, and this has to be handled nutritionally. Lipoprotein A levels are not affected by foods that you eat or your activity levels. There is no prescription medication that have an impact in reducing these levels. And it's a very unique one because it continues to hurt even after you've had a bypass. So if you've had a bypass and you're still hurting, it's more than likely your lipoprotein A levels. So what are some supplements that can help? Turmeric. Turmeric is very researched and it's a great herb, and you can find tons of articles on PubMed for these amazing benefits of turmeric. Gabe and myself take a pill with turmeric and rosemary every day, and it helps with circulation, lymphatics, and is super great at inflammation control. Another one is CoQ10. CoQ10, if you deprive your heart of CoQ10, it's like removing a spark plug from your engine. It just doesn't work, okay? Low levels of CoQ10 are implicated in virtually all cardiovascular diseases, including angina, hypertension, myocardial infarction, congestive heart failure. So it's important to have a good CoQ10, and the best form to absorb is ubiquinone. So increasing DPA and EPA to approximately 700 milligrams a day are associated with overall reduction of death from all causes, as well as coronary diseases related mortality. So studies show that those with lower EPA and DHA were at a significantly greater risk for coronary heart disease. We discussed how important those good fats are in our digestion talk. So if you want to go back and look at that, I encourage you to do so. Everyone should have a high quality fish oil, not one that you buy at a health food store because it's not high quality. Most of the time, those fish that they use for that fish oil happened because of Fukushima, and they have radiation saturated fish. So they are using those fish, and that's what you're consuming. So you want to make sure that you have a high quality fish oil. So if you burp up fish later, that means it's rancid, it's not high quality, and I encourage you to throw it away. I don't care how much money you've spent on it. So if you want a good high quality fish oil, you can contact us at functionalmedicinekc.com to get that. The literature says that fish oil actually shuts off the Alzheimer's gene. So consuming 3 fish meals per week actually can cut your Alzheimer's by 60%. But make sure that it is wild caught cold water fish, not farm raised, okay? Farm raised actually does the opposite. Make sure that you're getting that wild caught fish. Don't get cheap oils. Costco, Walmart, Walgreens, wherever, health food stores, you do not want fish oil from the bottom of the barrel, okay? Quality fish oil is something that my entire family, even my dogs, consume every single day. And if you have low levels of omegas, you have a significant increase in heart disease. So you want to make sure that you get a high quality. You can try Mindwise. This is Mindwise from Young Living. It's a good supplement. It has MCT oil, which is fractionated coconut oil, and it's really good for the body. It does have the ubiquinone, the CoQ10 that I talked about, has turmeric, among a lot of other great things in it to help support a healthy mind and heart function. If you don't have good fats, either from supplementation or from your healthy diet, then your blood will become very thick and it will have poor blood viscosity. With it being thick and sticky, you have a high chance of having it stick to the artery walls. You want to make sure that your blood is slippery and can flow properly. That's what good oils can do too. So I wanted to take a moment to clear something up here as well. Anyone can have this issue. I don't care if you are vegan or vegetarian, you can have this issue as well. And in fact, it could be more likely to have these issues because you're not consuming the proteins and fats that the body actually needs to function properly. I have had many vegan and vegetarian patients come in and we run the blood work on them. And as I'm going through it and making their lab report, their blood is not any better and sometimes, quite honestly, worse than people that are eating paleo or ketogenic. So keep that in mind. Just because you're a vegetarian doesn't mean that you are necessarily healthier. It is my job as a mom and a holistic practitioner to research the purest forms of any recommendation that we provide. And through this process, I have researched many different companies over the years, and I have found that Young Living is the highest purity and therapeutic grade available. And this is the only brand that I trust for my family when I'm using oils. So if you're interested in learning therapeutic uses of these oils and how to safely apply them to your lifestyle, then I encourage you to go to my website at www.oilydoc.net and sign up for your package. And once you do, you get a full year of wellness coaching from me. You get weekly private video conferencing meetings where we can go in depth and discuss certain products, answer questions that you might have, and go over the safety for use for your body and for your home. So again, go to my website at www.oilydoc.net for more information. And if you liked what I talked about today, if you like the presentations that I am doing, do me a favor and like the button below and share it with your friends and family, because my purpose is to educate the world on healthier natural approaches. So join me next week as we will discuss a different topic. Until next time, love yourself, love your life, and love each other.